New data just released by the Oregon Health Authority reveals that COVID-19 related procedures accounted for over $40 million in commercial insurance payments to Oregon hospitals in 2021. Some hospitals received much more than others. Fox 12 investigative reporter Adrian Thomas live in the studio with more on that report tonight. Adrian.
Well, Riel, two common procedures mentioned by the OHA report are remdesivir, an antiviral medication, and monoclonal antibodies, which are lab-grown proteins designed to help the immune system. Now, during the pandemic, health experts looked to these two treatments as life-saving measures. Now, the report from OHA found major differences in the amounts paid by insurance companies to hospitals across the state. According to OHA, the median statewide payment for remdesivir was $5,506 a day in 2021. That's the median payment, but what individual hospitals were paid per day varies by location. For monoclonal antibodies, the median payment from insurance companies was $748 a day in 2021, and that dollar amount is amount per patient. Looking at remdesivir cost data, the highest insurance payout was Columbia Memorial Hospital in Astoria, which was paid $8,853 a day per patient. On the other hand, hospitals like Providence Portland Medical Center were only paid $4,210 per day per patient. Even within Providence, the report found major differences in payments for remdesivir. Providence Milwaukee, for example, received $8,315 per day. In looking at monoclonal antibody costs, the report found some of the hospitals that received the highest payments were Providence Portland at over $1,000 a day, Sky Lakes Medical Center at $938, and OHSU Hospital at $934 a day. On the lower end, Harney District Hospital, Grand Ronde Hospital, and Asante Ashland Community Hospital were all paid under $500 a day, less than half of Providence Portland's daily payments. Now, the report notes that the variance in payment amounts within a hospital is due to different copayment and deductible amounts paid by patients, in addition to the different levels of illness severity among patients. The hospital's negotiated payment rate with the insurance companies is a factor as well. We'll post the full report on kptv.com. Live in studio, Adrian Thomas, Fox 12 Oregon.